5 Morning News at 7.
Time now is 7:43. Good morning to you. There is a new option for people who want those dimples. Here to tell us more about DIMPLEPLASTY, Dr. Richard Jaffu. Come on, doctor. Tell me this isn't real. People are really having surgery to put dimples in their face?
Well, you know, it's a great point, Jolla. There is actually more of a fad. We're seeing, of course, with millennials, and it's, you know, we're certain celebrities, Brad Pitt and others, who have Mario Lopez, who have these, you know, prominent dimples. And so people are seeking out something called a dimpleplasty, which is a method that's used to actually to create dimples. Now, the problem with this procedure is that it can be very difficult to maintain a long-term result, and it's still obviously a surgical procedure, a little difficult to get some symmetry. I think what I want to emphasize, Jolla, as a plastic surgeon is to really remember, you know, it's a surgical procedure, maybe certainly permanent. And unlike, you know, patients that will come to see us for a rhinoplasty, they've been thinking about having their nose altered for years, or a facelift, what have you, this is a fad, and we really want to make sure that this is something that somebody realizes is going to alter their face, not just for a few months or a couple years, but long term.
I see your dimple, Dr. Jaffu. When you talk,
natural.
when you talk surgery, I mean, is it like, what do? Do they?
So, Jolla, they go from inside of the mouth. You can
Ooh.
make a small incision, and then basically you're passing a suture from the underside of the skin to the muscle. So the concept is that when you animate or move your facial muscles, the dimple is created. But the problem, Jolla, is that in some situations that dimple may be noticeable even without animation. So you might still notice an indentation. And say if a patient comes back, Jolla, after a few years and says, you know, I'm not really crazy about this anymore, it can be difficult to reverse it because you already have scar tissue in that area. You may need to add a filler or something else. So it's not as predictable a procedure as saying a rhinoplasty or some other operation that someone's thought about for many years, a standard tried and true procedure.
Okay, let's move on and talk about this healthy overweight. So this is what, people working out, but technically they're overweight because their BMI, the body mass index, is over 30. So there's a new study about this. What's going on? What's the latest?
Well, Jolla, the latest is, you know, we used to hear from earlier studies that you could be fat but fit. And the recent study, a wonderful study that came out of the European Heart Journal, they looked at about 17,000 people and they followed them over a 12-year period. And what they found was that if you were overweight and you didn't have any other metabolic red flags, in other words, you didn't have hypertension, you didn't have diabetes, you didn't have elevated cholesterol, but just being overweight itself increased your risk for coronary artery disease and heart attack. If you were just overweight, say a BMI of 25 to 29, the risk went up 26%. If you were obese, it was 28%. And so this study debunked the earlier myth that you could be fat but fit. The other fascinating part of this study was we're all obviously concerned about our weight, and so the study looked at people that were actually fit. In other words, were not overweight, but had some of these risk factors, and they found that if you had some of these markers, these metabolic markers of hypertension, high blood pressure, elevated cholesterol, that in fact you doubled your risk of heart disease. So you really can't be fat and fit, but you certainly can be fit and unhealthy and increase your risk for the heart disease. Now, it's reversible in many cases, is a good news, Jolla. So if you watch your weight, if you watch your diet, if you reduce alcohol and eliminate tobacco, many of these risk factors can be eliminated or reversed.
Yep, got to take care of your bodies.
Absolutely.
All right, Dr. Jaffu, always good to see you.
Good to see you.